The American Academy of Family Physicians, in their 2021 article, A Framework for Moving to a Primary Care-Based Healthcare System in the United States, states that ensuring that all people in the United States have affordable healthcare coverage that provides a defined set of essential healthcare benefits is necessary in order to move towards a healthier and more productive society. Healthcare should be universal. Today, I will first identify the problem with the current healthcare system in my ill. Second, I will explain those responsible for the problem and my blame. Third, I will suggest a solution to the problem and my cure. And fourth, I will discuss how the benefits outweigh the cost and my cost-to-benefit ratio. Now that I have outlined my argument, I will move on to identify the ill of my debate. The University of Minnesota, in their 2020 article, Problems of Health in the United States, insists that the United States relies largely on a direct fee system in which patients under 65 are expected to pay for medical costs themselves, aided by private health insurance, usually through one's employers. The issue with this is that not all employers offer healthcare benefits to employees, so this affects anyone who works in a place that doesn't offer benefits for their employees. Now that I have identified the ill, I will move on to explain those responsible for the ill. According to the National Academy of Sciences 2019 article, Summary of the Public Health System in the United States, the federal government plays a large role in the public health system in the country. It surveys the population's health status and health needs, sets policies and standards, passes laws and regulations, supports biomedical and health services research, and helps finance and sometimes delivers personal health services. The citizens of the United States are also to blame for the continuation of this issue. Many people advocate for universal health care, but very few put actions to those words. Now that I have discussed my blame, we will move on to the cure. David Rosenblum's 2020 article, The Precarious Path to Universal Health Coverage, states that the United States could have a national health plan that covers all residents at prices they can afford. The Congress and the President just have to decide to do it. Major medical care reforms happen only when one party has dominant control over the White House and both houses of Congress. Adapting to a universal healthcare system is not an easy transition, and some changes are required. It will not satisfy all, but it could change the lives of the less fortunate in many positive ways. It could be a choice between life and death for some. Now that I have discussed the cure to my argument, let's move on to the cost-to-benefit ratio. A cost to the universal healthcare system would be where the money is coming from. When people think about where this money is coming from, most people think of increasing taxes. We discussed earlier that not all jobs offer healthcare benefits to their employees. These employees, when faced with health-related issues, can have trouble finding adequate care to fit their needs. So implementing universal health care would decrease the number of people unable to access necessary health care. This is a benefit. Now that I have covered the cost-to-benefit ratio, I will move on to conclude my argument. Healthcare should be universal. Today, I have identified the issue or the ill. Next, I explained those responsible for the issue. I covered the solution to the ill. And lastly, I discussed the cost-to-benefit ratio. I hope that you all consider moving to a universal healthcare system.